Hello there, I'm Dr. Alyssa Shepherd, holistic pregnancy and birth coach. I'm also a chiropractor with a clinical focus in pregnancy, pediatrics, and postpartum care. And something that I'm asked about a lot is sciatica inside of pregnancy. Now, low back pain or pelvic pain in pregnancy is pretty common. In fact, it's currently estimated that somewhere between 50 to 80% of women experience low back pain, pelvic pain, or both inside pregnancy, which makes total sense when you think about the mechanics and the stresses of growing a human and housing that human inside this region of your body. And a lot of people think that sciatica is a diagnosis, but in actuality, it's a symptom and not a very fun one. At its worst, sciatica feels like a sharp electric zinging shooting from the region of your low back or your pelvis, moving down, possibly all the way down the back of your leg, and sometimes even as far as your toes, although it doesn't have to travel down the back of your leg. It's usually one-sided, and it can feel really debilitating when you get that electric zing. When someone with sciatica walks or limps into my office, they're looking for two things: to understand what's going on, and the bigger reason, for relief. Some really great news for you if you're pregnant and experiencing sciatica is that although outside pregnancy it often relates to the discs in the low back, it rarely does inside pregnancy. Inside pregnancy, sciatica can be caused by a number of factors, and it can be managed to help get you through your pregnancy with more comfort. Regardless of what's causing your sciatica, the commonality all the causes share is that something's irritating the sciatic nerve, which is this massive giant nerve bundle you see here coming from the low back and pelvic region down the back of your leg all the way to your toes. And it is a super important nerve. One reason the sciatic nerve can be irritated in pregnancy is from increased pressure on it. Any structure in this region where the sciatic nerve is traveling is capable of putting pressure on this nerve and giving you that sharp zinging sensation. Let's be more specific, because what's causing the irritation is going to determine how you deal with it to find relief. So it could be increased pressure on the sciatic nerve from weight gained inside of pregnancy, or from fluid, such as if you have polyhydramnios or excessive amniotic fluid. It could come from pressure in the area from your healthy growing uterus or from baby's position, especially if baby's beautiful head nestles right up to the region where your sciatic nerve's traveling. It can also come from changes in tension of soft tissues, such as the muscles in this region, as your growing belly shifts your center of alignment and gravity, which can cause these muscles to have to work harder so they get tighter. Or it could be related to the alignment and motion of your sacrum. Now, there's a number of ways you can deal with sciatica to help it be more manageable inside pregnancy. But it's important to recognize that that's the key word: management. You're not likely to have it go away completely and never have it come back inside pregnancy. That's not how pregnancy works. Your body is growing and housing a human, and as that happens, there's necessary shifts that are going to occur. But you can still find relief. You'll just likely need to keep doing the things that bring you relief, at least while you're pregnant. If you have a body worker you trust, like a chiropractor or a physiotherapist, they can be a godsend in helping you manage your sciatica and get some relief. And if you don't, it might be worthwhile to look into. Otherwise, if you're managing things on your own at home, you can use any number of different measures, which I teach people in my clinical practice and online, including in my mini course on comfort measures. To give you an idea, some things that you can do include stretches, yoga, exercises to mobilize your pelvis, massage, therapeutic taping of your belly and back, techniques from spinning babies to balance and reposition the soft tissues, or to help reposition baby. Or, if it's baby that's putting pressure on the sciatic nerve, you could actually talk to baby about this and ask them to shift even just ever so slightly, so long as it's still good for them. Babies are smart and so sentient, and your baby loves you, so they're pretty likely to help you if you ask them to. Now, I'm going to go through some of these at-home methods in more detail in future videos to help you get more relief. But remember, sciatica inside pregnancy isn't forever, and there's lots you can do to feel more comfortable before you give birth. If you know of someone who could benefit from the info inside this video, please share it with them. And click the subscribe button yourself so you can keep catching awesome content and learning. Details for my courses or how to access more support can be found in the description below this video. I hope this was helpful. Thank you so much for watching. Bye for now.